Eastern Health's Healthy Connection radio program. I'm your host, Amanda Crabtree, and we are broadcasting live from the Nelson & Nelson building on WAGR 1340 AM, and we are also streaming live on the Southeastern Health Facebook page. So if you'd like to watch us while you're listening, you can go to Southeastern Health on Facebook while we live stream. Today we are going to be addressing the topic of the opioid crisis, and we have two of our guests in studio, and we're joined later by another. I'd like to welcome Dr. Joe Roberts. He is Southeastern Health Vice President of Clinical Effectiveness and Medical Affairs. Welcome.
Thank you.
And Lakeisha Hammonds is Director of Southeastern Health's Community Health Services. Welcome, Lakeisha.
Thank you.
And we'll be joined a little later by Dr. Robin Peace. She is a provider with Southeastern Medical Clinic North Lumberton, and so she's going to be joining us shortly. So just wanted to share a couple of statistics to sort of start us off. According to the U.S. Department of Health and Human Services, the opioid epidemic in one recent year, 2015, 12.5 million people misused prescription opioids. 15,281 people are believed to have died from prescription opioid overdose, and 2 million people had a prescription opioid use disorder. One more statistic, and this is a little more local slant. According to the North Carolina Office of the Governor, across North Carolina, opioid-related deaths rose 73% from 2005 to 2015. Statewide, opioid-related deaths climbed from 642 in 2005 to 1,110 in 2015. During that same period, the number of Robeson County deaths more than doubled from 5 to 11. And so these are some staggering statistics. We know that the opioid crisis has gotten some national attention recently. Everyone is looking for ways to address this and what is from a local perspective and from a national perspective. And Lakeisha, if we could start out, I know that your area, Community Health Services, partners with the local health department to do the community health needs assessment every year. And so how does that address opioid crisis?
Okay. Well, our community health needs assessment is done in conjunction with our Robeson County Health Department, in addition to many other local organizations. Robeson Healthcare Corporation, United Way, those were really main players that were at the table this year for our 2017 Community Health Needs Assessment. In addition to that, we had a work group, an advisory group. I did just name you the work group. An advisory group that consisted probably of 15 to 20 additional people through multiple different agencies that assist with that. The premise of the Community Health Needs Assessment, basically what that looks at is taking perception versus reality. And what I mean by that is we look at the community by actually going out and assessing and surveying our community through either surveys or focus groups. And we ask the community in their opinion, what do you think most people die from in your area? What do you think are the biggest health issues of concern? So there's several questions that we ask those individuals to obtain their perspective. And that's the perception piece of it. Where that perception meets reality is we take that information and we look at the statistics like you just read. And then we combine those two things. And then what we come up with as a group is we look at priority focus areas. And for our 2017 Community Health Needs Assessment, our priority focus areas are obesity, taking a specific look at nutrition and physical activity, in addition to substance misuse and abuse and mental health. And one of our key focus areas will be prescription drug abuse. In addition to that, this year we have a third focus area that will be added, and that is social determinants of health, and specifically looking at education. We have actually partnered and done the Community Health Needs Assessment for as long as I can remember that I've been employed with Southeastern Health. And probably I would say 2007, that substance misuse and abuse or prescription drugs has been a huge issue of concern. And so we've been working on ways to address those, which I'm sure you'll ask me about a little bit later on in this show, so I'll tell you more about that.
Okay, thank you, Lakeisha.
Yes.
We'd like to welcome to the studio Dr. Robin Peace with Southeastern Medical Clinic North Lumberton. Thanks for joining us.
Thank you. Sorry I'm late.
Oh, you're quite all right. Dr. Roberts, you wear two hats. You have been a private practice physician, and you also are an administrator now at Southeastern Health. Talk to us a little bit about those two perspectives when it comes to the opioid crisis.
Well, I'm glad Robin is here because she can help me with the provider perspective, but I still feel like that I have my foot in the door as far as opioid prescribing as an outpatient. As far as administrative-wise, Southeastern as an organization has a good understanding of the issue. The statistics that you quoted, I think most of the administration at Southeastern understands that and understands that it is an issue. It is such an issue that it has actually gone to the board level of the hospital, and at our last full board meeting, I will tell you that the largest portion of time actually was spent on discussion of this opioid crisis. Southeastern, for a number of years, has had a opioid policy in place, and they do have a pain champion in Dr. Chandwani. And he has been instrumental in providing guidance and updating the physician network on the opioid epidemic. He keeps abreast of the CDC guidelines for opioid prescribing. He is very active in the network, and he is also very active in Access Care, which is a group of local Medicaid providers. And again, he provides us direction and policies for opioid prescribing in that group as well. So I think in general, the administration, the board, the leadership of the organization, we are all on board and understand that this is an issue.
Okay. And just to remind our listeners, we are talking today about the opioid crisis, and my guests are Lakeisha Hammonds, Director of Southeastern Health's Community Health Services, Dr. Robin Peace, Family Medicine Specialist at Southeastern Medical Clinic, North Lumberton, and Dr. Joe Roberts, Southeastern Health Vice President of Clinical Effectiveness and Medical Affairs. You're watching us streaming live on Facebook, and we are broadcasting live from WAGR 1340 AM. Dr. Peace, share with us your perspective as someone who is actually seeing patients on a daily basis who are trying to deal with pain and then get caught up in this vicious cycle, or alternatives. Sort of how are our physicians addressing the opioid crisis?
Well, I certainly think that it is something that is improving in terms of providers in our community realizing the seriousness of the epidemic in our patients that we serve. I mean, because the opiates that are in our community, they were prescribed. And so there has been attention paid to the quantity of opiate type medicines given to patients, which I have felt was one of the issues. If you give a patient 240 quantity, then they could use half of that and potentially divert the other half. And so I think that with the chronic pain guidelines that have come out from the CDC, that is one of the things that is addressed in those guidelines, is not only the type of opiates that we use, but how many are prescribed to an individual. So I think that that is helping. The guidelines have helped. You know, providers don't want their patients to suffer. I don't want my patients to suffer. But we also don't want to contribute to the epidemic that is at hand. So in order to educate our patients about why we say no, that takes time. And those of us that are in primary care, we have a limited amount of time with individual patients. And so we're challenged with having the time to explain to patients why alternatives to opiates would be in their best interest. Do opiates relieve pain? Absolutely. Okay?
There is a purpose.
There is a
They serve a
purpose.
purpose,
They
yes.
serve a purpose,
Yeah.
okay? And so when Mr. So-and-so gets a Percocet from his wife or brother or cousin, it is going to help relieve whatever that pain is that he has.
And what might that pain be? Is this a surgical pain or is
It could
chronic?
be any
What
pain.
might it be?
I think that probably the most common pain that opiates are prescribed for is back pain
Okay.
or some type of arthritis or joint pain.
Okay.
And so if a person has a chronic back pain problem and they complain to a family member and that family member has an opiate type pain medicine like Percocet or Lorcet, they think they're helping them by saying, take one of these. They take it, it helps. They come to see their family doctor and they say, well, Dr. Peace, I know I wasn't supposed to,
Right.
but my family member gave me a Percocet and it really helped.
Yeah.
So then I have to make the time to explain why, though it may have helped, there are safer options that we need to try, because this is the downside of this Percocet. You know, no one wants to be addicted to Percocet or pain pills. It happens, you know, over time. Sometimes it happens with the first pill.
And what is that process? How does that work?
Addiction?
Yes, to the opioid.
So, you know, I think some people are predisposed to developing addiction. Okay?
So it's like any other drug addiction. It's just their bodies start feeling like that's their new normal, and they have to take more.
Well, for some people, for a lot of people, I think that find themselves addicted to opiates, they initially took the medicine because they had a pain. But then they continued to take that Percocet for a period of time, and somewhere along the way, they started taking it because it helped them feel better emotionally. Or, you know, they got a euphoria, or it made them feel good, if you will. And so they stopped taking it for pain and they started taking it for another reason. And then their body gets dependent on it, and then when they don't have it, they go through withdrawal. And for some people, they will go at length to get it, including buying it off the street, including stealing, you know, and that's when it goes into an addiction. You know, not everyone that takes pain pills are addicted. Some people are dependent upon them, you know, because they have a chronic problem and they may very well need to take it. It's difference between dependency and addiction. And not everybody that takes it is going to be addicted, but we don't know who that's going to happen to. And so I'm always saying, you know, let's try something
Try an
else.
alternative.
That's exactly right.
Robin, I heard you talk about the limited time that physicians have with spending with patients, and the issue of a patient maybe demanding the medication. And it's been my experience in talking with a lot of physicians that, just like you say, they don't have time, and the path of least resistance a lot of times is saying, sure, why not, and that gets the ball rolling.
Absolutely.
Is that this term doctor shopping that we hear, where if you tell me no, I'm just going to keep trying someone else until?
Well, doctor shopping and what Dr. Roberts was saying is a little different.
Okay.
You know, because doctor shopping is if they don't get it from me, then they go to Dr. Roberts. And if he doesn't give it to them, then they go to someone else.
Right.
But in terms of a provider, you know, and we are all at different levels of experience. And so when you have a younger provider, whether it be a PA, nurse practitioner, MD, DO, whatever the case may be, they may be more concerned about saying no to a patient because they're trying to establish themselves in their practice.
We've been through that.
Been there many
We were-
years
we were
ago.
We were the
And
new
you are
physicians at the
seasoned
time.
physicians, so
Yes.
and they're done that,
we
right?
were,
Yes.
we were inundated
Yes,
with
so there is that.
patients.
Yeah.
And then there is the fact that it takes time to explain why you're saying no. And so the path of least resistance, like Dr. Roberts said, is to just give them the medicine. But as an individual provider, you know, we all have to be more responsible in our writing, our prescribing habits. I mean, it's up to every individual provider to take the time, you know, to not be bullied, you know, and I have had patients to threaten me over the years. You know,
There was actually a case of a physician being killed.
Gunned down.
Over denying a
That's right.
prescription.
That's right.
And again, the taking the time includes using the North Carolina Controlled Substance Reporting System.
Absolutely.
Which is a big part of the responsibility of physicians in prescribing opioids. And when you're talking about patients that are doctor shopping, that is one of the best means for a physician to determine if that indeed is what that patient is doing.
That
And that's-
absolutely is.
And that's a registry with the pharmacies, I understand, where.
It's a North
State-
Carolina.
statewide.
And the pharmacists are keyed in on that, the physicians, they can go in and check frequency of how often someone's getting a certain type of prescription.
Right.
And who's giving it to
And
them.
who's giving it.
That's,
fact-
and what drugstore they use.
With the most recent legislation with the STOP Act, required pharmacies to update that registry within 24 hours as opposed to 72 hours. And one of the other issues in Robeson County, with us being so close to the border of South Carolina, is hoping to get the ability to look at a South Carolina registry because we have patients that are crossing the line
Oh, sure.
to get prescriptions filled both in North and South Carolina.
Oh, that's interesting.
It's
Way
been
to
very
go,
helpful,
too,
though.
crossing the state line.
The
Yeah.
registry has been very helpful, but it's only as helpful as if you go in and look.
It's only, right.
Okay,
You use
so
it, right.
that's exactly right. You have to use
The
it
tool that you
in
have to
order
use.
for it to be helpful. And now we can have a delegate. As a provider, we can delegate our nurse to go in and print out the report of an individual that we are considering prescribing a controlled substance and use that as a part of our decision making as to whether or not we feel like it's appropriate for an individual. You know, the issue is not just prescribing Percocet or opiate pain medicines. The issue is when they're given chronically. You know, you may need a short duration of that type of pain medicine, but it is month after month, month after month, year after year, is when it becomes a concern. And it's really just not recommended. You know, for chronic back pain, it's not generally recommended. And not all pain requires a Percocet. You know, yes, it will relieve most pains, but that doesn't mean that's what you should use. There are alternatives that can still be effective and safer. And that's the education that needs to take place within our community. There is a culture in this country. It's not just Robeson County. It is the whole United
It's
States.
the national.
That's exactly
for
right.
sure.
We use 80% of the opiates that are consumed on this planet. Okay?
Yeah.
So that means the rest of the world is hurting, I guess. And they're okay with it.
Part of the education process that Robin is talking about has a lot to do with what Lakeisha is spearheading. And both Robin and myself have had the opportunity to be involved with meetings that are involving both pharmacists, dentists, law enforcement, behavioral health providers, all of the people that have a stake and have a responsibility of the opioid crisis. And I would say just personally, being at these meetings have really educated me
Yes.
and given me a perspective from the law enforcement side,
Yes.
from the behavioral health side, from the pharmacy side. So Lakeisha may want to talk about that.
Yes, we want to,
some.
definitely want to get to her task force, and
Yes.
you'll share the name with us.
Okay. And the name is a mouthful. It is the Substance Misuse Awareness and Recovery Task Force. It's the name of our group.
Smart.
For
That's all I can remember.
for purposes of this interview, I'll just call it the task force.
Yeah, okay.
At this time. But our task force is made up of many sectors. We have the faith community, we have law enforcement. Definitely, we have our medical providers and pharmacists on board with that. So we just have a variety of sectors that we engage with for this task force, and there are many things that we're looking to do as far as strategies are concerned. Number one is awareness, to promote the awareness and the education around the stigma that's going on with this, but also with the problem. And there's several tactics that we're using, which I can share with that. One of the main tactics is to signage and to talk about the controlled substance reporting system. in our ED, if you walk to the hospital at Southeastern Health, in our emergency department, you'll see prominently posted throughout that, they utilize the controlled substance reporting system. And, that the opiates, will not be prescribed for, X amount of time. So that's done. In our clinics that our providers are in, that signage is prominently in the lobby. And I'm sure Dr. Peace and her colleagues and Dr. Roberts will tell them when they go in, they know that, you're going to check the controlled substance reporting system.
Can I just mention one thing? There has been an issue with the physician sign up for the registry. And it's been slow in Robeson County, but I think there is some momentum, especially with these meetings, to increase that registry sign up. I was told, and you may have some updated information, that we were at around 36 to 38% of total providers in Robeson County that had signed up for the registry. Do you have any information about any updated information as to the extent of usage in Robeson County?
No, sir, I do not have any updated information with me at this time. However, I can say that it has increased. You're correct. It has increased since these initial efforts have started. So the awareness is out there. Colleagues are talking to colleagues. Colleagues are encouraging colleagues. And these series of meetings that we are having, and this just awareness overall is really helping. What we're hoping to lead up to with these series is not just talking. We call them roundtables, but we don't want to just sit around the table and talk forever. We're hoping for impact.
Sure.
That is our goal that we're working towards with this. Additionally, some of the other things that we have to look at is these medications that are prescribed. We're looking at, okay, how can you safely dispose of those?
Like
So-
Dr. P said, some people get a prescription, they only need
Mhm.
half of it. So then
Right.
they have this bottle of pills in their medicine cabinet that
Mhm.
is vulnerable to other people sharing or stealing
Absolutely.
or
Or
their
selling.
children.
or-
Yes.
It makes you a target
Yes,
also.
absolutely.
Yes,
So
yes.
you all have come up with some partnerships to dispose of those
Yes,
safely.
yes, we partner closely with our Robeson County Safe Kids Coalition.
Mhm.
There's actually what's called a take back event that will be held this Saturday, the
Okay.
28th, from 10 until 2 at Biggs Park Mall.
Okay.
And so you can bring any unused medications that you have. It could be as far back as 1998 to 1968. It's okay. It's fine to bring those medications back. There will be no questions asked. There will be, sheriff officials there that will take those medications and they will properly dispose of them. If you
Okay.
can't make the take back event, there's actually other drop off locations throughout the community. Robeson County Sheriff's Department has 2 drug drop boxes. In addition to the Fayetteville Road location of Lumberton Drug, there is a location there. Also in St. Paul's, Brisson Drugs has a drop-off location, and Maxton Police Department. Also, the task force is really working very hard to have additional locations coming soon. So there will be additional locations. If anyone has questions, they can call 910-671-5595 to inquire about the additional locations that will be coming soon, and we'll be more than happy to share those with our listeners.
Now, for those drop-off locations, is that no questions asked too? You
Yes.
just walk into the lobby of the Maxton
Absolutely.
Police Department and drop off
Just
your
drop it off. Just get rid of it,
medication,
yes.
no
Drop
questions?
it
Okay. Oh, that's good to know.
Yes, we want
for
to get them off the
listeners.
street.
Okay.
Yes.
All right, so we've got just a few more minutes left in our program. I'll sort of do a roundtable and see if there's anything you want to add or share with our listeners. Resources, Lakeisha shared that phone number. Also, I would like to share the number to Southeastern Psychiatry Clinic. We know that addiction is a large problem throughout the nation, and so they offer some resources to help with that. And their number is 910-272-3030. Dr. Peace, is there any closing remarks you'd like to make?
I think that what I'd like to say in closing is that it's not only important for us as providers and administrators and a part of the task force to bring awareness, but we also know that there are a lot of people in our community that need treatment of their opiate addiction. And there is resources available. There are resources available for them to receive that treatment. I don't know if we have the 1-800 number for Monarch available, but it's something that people could go online. There's a 1-800 number, not Monarch, but East Point.
Yes.
East Point. There's a 1-800 number for East Point.
Self-triage type.
Self-triage type, where an individual that is struggling with an opiate addiction or an addiction, they can call that 1-800 number with East Point, and they will help direct them to treatment options. I
Okay.
think that's important to say. And just be afraid of opiates. You know, I think that there is not enough fear in the people in our community about these pills. You know, not only about the fact that they could lead to an addiction, but the fact that a person could have an accidental overdose. And there's so many of our young people and people in our community that that's what they died from, is an unintentional overdose, because they didn't understand the power of these drugs and how they interact with maybe some other medicines that they take, like anxiety or nerve pills like Xanax. So that's what I would like to leave, that these medicines are dangerous. And if there is any other alternative that you can do to relieve your pain, then you need to look for that. You need to ask your doctor, I don't want that if I don't have to have it. Please give me something else, because Dr. P said that they were dangerous.
Yes, absolutely. And we're seeing that in the statistics.
Yes.
Dr. Joe Roberts, would you like to?
All right, it's hard to
share
follow up from Robin. I would say that as an administrator at Southeastern Regional, I am so glad to have people like Dr. Peace that have such a passion for caring for patients and issues such as this. She is such a good spokesperson for this crisis. Her, along with Dr. Dennis Stewart, Dr. Chandwani, they are really spearheading the issue for Southeastern. And again, I would just like to reiterate that the administration is 100% behind this. The board is 100% behind this, and it's something that we take seriously. And I think with Lakeisha's help, that we will make a big dent in this issue.
Lakeisha, if someone's interested in more information about your task force, if you'll share that number again, or any of
Yes.
those resources.
Absolutely, and I just want to say it takes a village. And that
Absolutely.
number is 910-671-5595, and we welcome community support and participants as well.
And I'd just like to thank our guests today, Lakeisha Hammonds, Southeastern Health Director of Community Health Services, Dr. Joe Roberts, Southeastern Health Vice President of Clinical Effectiveness and Medical Affairs, and Dr. Robin Peace, Family Medicine Specialist with Southeastern Medical Clinic, North Lumberton. Thank you all for taking time out of your
Thank you.
day
Thank you.
and for addressing this important topic with us. Thank you for those who joined us on Facebook Live and for those who are listening live on WAGR 1340 AM. There will be an article about this featuring these same folks in our winter 2017-18 edition of HealthWise. And so that'll be out in the middle of November. We encourage our listeners to pick that up to get more information, a recap of what we talked about today, and some of those important phone numbers. So thank you for joining us. We're here on the fourth Wednesday of each month at noon. Southeastern Health, Healthy Connection.